There we go. Please know that all Chamber Chat Live events are recorded and we share them later on our website and on social. So we are recording now. I believe that we have Councilor Cliff Lazenby, Councilor Petra Huda on the line. I think Senator Fuller Clark has signed up to join us, although I don't see her yet unless you see her, Jen.
John Tabor should be arriving as well.
Okay.
I do not see
We'll hope that Councilor Tabor joins us as well. So we're always pleased when folks in the city join us. And speaking of that, we do have two very important folks with us, Kim McNamara, the health officer for the city, and Dr. Bianca Montero, who, she does not work for the city. She is on the Citizens Response Task Force Health Subcommittee, which she'll tell you more about when she speaks. So we're very excited to have them there today. So I want to get through some quick chamber news. The holiday fundraiser that we normally have every year, which is usually a wine tasting, and the last couple of years it's turned into a wine, beer, and hard cider tasting, which has been awesome. We are obviously not going to have this year, but we are going to do something called Hope for the Holidays, which Jen and Ben are working on. Details are not ready to share with you yet, but we are going to be doing something fun and something that you'll feel good about for the holidays. So working on that. I want to update you on the BEA and
Is there someone else waiting for this book? Is there someone else waiting for this book?
I am going to put them on mute. Whoever that was. And there you go. So you know that we've spoken before about the fact that the state, the Business of Economic Affairs, has allocated some funds to the 7 regions of the state to help our businesses with the recovery, the COVID-19 recovery. And the 6 chambers of the Seacoast, which makes up the Seacoast Chamber Alliance, are working on different initiatives. So today, you would have seen Jen put out there, both in an email to our membership and on social, the B2B emails, which we're going to start sending out on Thursdays and or Fridays, depending on when we collect the information. And you'll see those coming in. Hopefully they don't go into your spam, but it is full of really helpful information, information about like the Main Street 2.0 funding opportunities, webinars that are upcoming that will help you, and so on. So please pull those out of your spam if that's where they go, because I think that you're really going to be interested in what they have to say. We've also sent out, Jen is going to put out some information about this new Seacoast Safe program. And that is a pledge that we're asking our members to take that says we are doing absolutely everything possible, everything within our power to follow the guidelines that are put out by the state and the city to keep our businesses, our business space safe, so that we can welcome folks in a very safe manner. And you can feel good about that. And so you can sign up to take the pledge. You get a window cling. It's all free. You get a window cling to put in your front window that says, I took the Seacoast Safe Pledge. You get something that you can download. You'll have a link to be able to download something that you can put on your wall or on your front desk that says, we took the Seacoast Safe Pledge and this is what it means. We're following these guidelines and so on. So that's coming out. We're also doing workforce development work, economic recovery work. We will start launching some destination marketing. We're being very, very careful about who that goes out to and what we're saying. The basic message is support your local businesses and staycations and stay safe. And but we do ask you to try to support your local shops and restaurants and all of our businesses leading up to the end of the year. We know that we're going to have a tough time for the next probably 4 months, right? The rest of November, December, January, February, until the weather starts clearing up a little bit, hopefully in March, and then things should be loosening up. We're going to hear more about that from Kim and Bianca. So make sure that the last thing that we've done with this Seacoast Chamber Alliance and the BEA CARES Act funds is we've developed a new website that will have a lot of this information. We're gathering all this information. So visit seacoastnh.com. I welcome you to take a look at that and give us your feedback. It's still under construction at some level. So give us your feedback and let us know what it looks like. Reminder that you should also be looking at the city's website and our Chamber of Portsmouth Collaborative.org website for all of the information that you're needing on access to resources and information that we're getting in from the state, from national, from everywhere, and we're trying to share with you. So the Citizens Response Task Force, just to give you an update, a quick update on that. Thanks, Judy. We are looking forward. We're looking ahead to spring and summer next year in the public realm subcommittee. What are we going to do to get our businesses back out on the streets, our restaurants back out on the street, our shops open, 15-minute parking areas around town over the winter so that we can keep people coming into your businesses. So reminder, we will open up for questions once all of our guests have spoken. Please enter your questions through the chat function. Jen's going to be monitoring that chat function. We're going to start with Dr. Bianca Montero, who is a pulmonary and critical physician in Dover, affiliated with multiple hospitals in the area. She's the medical director of the ICU at York Hospital, where she has worked in COVID planning response development. She serves on the health subcommittee of the Portsmouth Citizens Response Task Force. We're lucky to have her this afternoon as she is on duty at the hospital in the ICU unit. So we may lose her at some point. So we've teed her up first so that we can make sure that we hear from her. So thank you so much, Bianca, for being here with us.
Good afternoon. Thank you, Valerie, for this very kind invitation. So as some of you may know, the Citizen Response Task Force was created sort of towards the end of the spring into the summer, and was a very diverse group of people chosen by the mayor and the city councilors to really help the community in Portsmouth to reopen from an economical standpoint and also a safety standpoint and navigate through the COVID crisis. The health subcommittee was then created a few weeks into those meetings, and it was a group of us, Ann Berner as a chair and some other members. We would meet weekly, just like the task force did. And we started discussing ways to put together documents and information for all the business as they were opening, and also the citizens of Portsmouth. We created several documents with a significant help and support of Stephanie Secor that works for the city. And we created frequent asked questions in regards to testing, to masks, to ventilation, also with support of James Peterson, who is an engineer and has a lot of knowledge with HVAC systems. They're all, they're PDF information as well as links on the website of the city and also in the Citizens Task Force website. And we also create a weekly dashboard, which is, as we find, probably the most important information that we can create, and it changes every week, that we present on our weekly meetings. And if I may share my screen here, I can bring up the most recent, if I find now. So of course I'm not finding my most one, but this is the one. There we go. So this was the dashboard that we presented this past week on our meeting. We had a subcommittee meeting Tuesday morning, followed by the full task force on Tuesday afternoon. So basically here, as some of you may have seen on the website that gets published every week, we have different portions to this dashboard. We have a local, state, and county area data here that we use positivity rates. We have this community transmission that goes by color, that goes from green, yellow, and red, being green sort of a minimal to no transmission, a yellow sort of like a moderate transmission, so starting to like an uptick in cases, and in red, a substantial amount of community transmission. So this is as of last Monday when Stephanie Secor helped us put this together. So as you can see, most of the counties in the state of New Hampshire are with substantial transmission. Then we come down here to these two graphs that we have COVID-19 infections since at least we're going back in July up to now November. And this is the total amount. New Hampshire in blue, and then on the bottom in red, Rockingham County. The second graph here, you see now the number of infections from July up to November, and you can see a marked increase in the number of infections here and hospitalizations. And this is more of our local level, Portsmouth. You see here in red is the number of current cases, active cases in Portsmouth. So you can see from the summer up to now in the fall, a significant uptick in cases. And then here in the middle, we also add a little bit of information of Massachusetts and Maine, because a lot of people commute and work on both states. And we have also the tourism, right, that we have quite a bit in our city. So, and then we have the trends. And usually this is data going back 14 days. So this is not the past 7 days, it's not the actual, just the last 24 hours, it's going into a trend. So the numbers may be slightly different than what it is today. But you can see New Hampshire was trending poorly in the last 2 weeks with a continuous increase in numbers, the same as Massachusetts was actually now uncontrolled spread, and Maine also trending poorly. Up here, you also have information from the CDC and the state of New Hampshire, a significant increase in cases. And our positivity rate, which is, as of Tuesday, was at 2.7 in the state and 2.9 in Rockingham. Right now is very different. So I just pulled, as of today, with the significant number of cases in the last few days, we are now up to 4.8. So there's a significant jump in our positivity rate in the last few days. So this is here, what do we see in the whole country, right? In the darker colors, you see significant community transmission, high positivity rates, and us here in the Northeast, sort of more into the yellow orange, but clearly if we could just trend all those maps since we start doing this dashboard, has been a significant change, right? And for this dashboard, we use several sources. We use the Johns Hopkins website. We use our own CDC website. We use the Massachusetts and the Maine COVID tracking and COVID Act Now websites, which have a pretty good data in terms of overall positivity and cases. So this is pretty much what we've been working on. Most recently, we've been just updating sites for testing. So anybody in the community that wants to know any information of where to get tests, what kind of test between PCR and antigen tests, all of those are in the website. We listed several different locations, and we have absolutely no attachment to any of them. We just basically get a list of local areas that people can go and get tested. We were able to gather some information about some need appointments, some don't, and we just have it all listed there. There's also frequent asked questions about masks and daily lives, which we are currently working on and sort of adapting a little bit with the changes. But those are very important documents that everybody has access to, and it's public information.
Okay, is that, thank you. Thank you, Dr. Montero. That's, it's a little scary, those lines. I do have to give a shout out to Stephanie Secord, who I know compiles a lot of that data for the health subcommittee on a weekly basis and shares it with the entire task force. And we always, well, I was going to say we always look forward to getting that information. Maybe not so much, but it's great information to have. And while it's not always the way that we want it to look, and it's a little scary at times, it's great information to have. So thank you very much for that. So Kim McNamara, has a Bachelor of Science in Medical Microbiology from UNH and her Master's from Johns Hopkins Environmental Science and Policy. She's a registered environmental health specialist and has been serving the City of Portsmouth for 15 years, first as a health inspector and now the health officer. Prior to working in Portsmouth, Kim worked in public health in Manchester and has experience in clinical and research labs. I will also add that she is one of the hardest working people I know, while still maintaining her great sense of humor. So we like to have health officers with a sense of humor. So thank you for being here.
Thank you. I'm going to try to share my screen. Apologize. There we go. It's been a day for computer issues. I'm so sorry. This is probably operator error. This is terrible. Come on. I'm going to have to try to reload this. I apologize.
We know that Kim is working on a couple of different computers in front of her. So we know that, well, I know that with one computer, my technology is not always the best. With two computers, I can't imagine. So
Yes, I apologize so much. Hopefully this will do it. Ta-da.
yay.
All right. My apologies for that. So good afternoon and thank you. Today I'm going to brief you on why it's important to achieve herd immunity through vaccination instead of letting our guard down, why droplet transmission is difficult to evaluate in indoor environments, some new information on why this virus may be so contagious, and some reasons for optimism through advances in pharmaceutical research. On March 13th of this year, COVID-19 was declared a national emergency and we're still there. There have been 3 waves nationally of COVID infections since March, but New Hampshire escaped the second wave over the summer, probably for several reasons, but certainly the fact that we were very careful about visitors and we were staying out of crowds, we were wearing masks, we were doing distancing. And at that point in time, there weren't many of us that were actually infected. So when you have a low infection rate, below 1%, it's much easier to control, and you cannot spread infection if you're not infected yourself. There is some reason for some optimism for this coming spring, summer, and fall, but we have a tough winter ahead unless we can set some priorities as a community and make some hard choices, at least for the next 2 to 3 months. If we can get the infection rate back down 1%, that will ease the burden of illness and quarantines. It's not just the people who are confirmed positive that have to quarantine. It's all that they had close contact with, and people are having significantly more contact with others now, so it's becoming very disruptive. If safe and effective vaccines are discovered, that will ease the burden as well as better pharmaceuticals. So although there's a long way to go, we have a better understanding of COVID and its transmission with a few more months of research behind us, but please keep in mind that our current understanding is preliminary and will change as more research and practices develop. I'm sure you've heard the term herd immunity with both positive and negative connotations. Herd immunity is a long-standing public health principle, though. It is simply when a population reaches a level of immunity that stops outbreaks from occurring. Herd immunity by vaccination has contributed substantially to increased life expectancy of persons across the globe. But some people have argued that COVID should just be left to run rampant so that we can achieve natural infection and immunity. How do I go back? I'm so sorry, this is not working. How do I reverse to the previous slide?
I think that you should be able to hit back on your,
There we go.
your movement keys there.
So the slide on the, or as this slide shows, in a community that's never seen a particular virus before, such as COVID, no one has immunity. So we're all either acceptable or infected, and that is where we are right now. The slide on the right shows what we're trying to achieve. With a greater share of the population immune, the virus cannot easily reach the few that are not. You will see some infections, but at a much lower level. Even vaccines do not always produce a level of immunity in a person that will protect them, and some people do not get vaccinated for medical or other reasons. So we'll always have a percentage of unvaccinated people. But the immunity can either be by getting infected or by widespread vaccination, and widespread vaccination is preferable because they are much safer than becoming sick with many infectious diseases. This vaccine safety is because of the rigorous process that vaccines have to go through to be approved. Allowing natural infection to create herd immunity would lead to unnecessary deaths and disabilities, and we don't understand all the potential long-term effects yet. Just allowing everyone to get sick and worse would only create further disruption of life, education, and commerce, and it would overwhelm our healthcare system. As Dr. Montero was talking about our raising rates of infection locally, hospitals and deaths lag behind case counts, so we can expect to see these numbers rise as well as the community-wide transmission increases. With highly infectious diseases like the SARS virus, a good percentage of the population has to be immune to reduce the number of additional outbreaks. Estimates range from 70 to 80% of the population need to be immune to achieve effective herd immunity for COVID. Despite all the suffering and sacrifice that we've seen though, even countries that have avoided imposing the basic public health measures that we've all been using, they are far from achieving herd immunity on a national level. Sweden tried to allow herd immunity to occur through natural transmission, and they didn't close down. Public transportation, restaurants, schools, gyms, theaters, etc., were allowed to operate as usual. They had some reduction in activities, like public gatherings were limited to 50 or fewer, and a few other sectors were curtailed, but masks and distancing were not required, and for the most part, everything remained fully open. While its neighbors, Norway and Finland, did take measures to restrict transmission. According to the WHO statistics, as of November 13th, Sweden's approach to let herd immunity occur naturally has resulted in 166,707 cases and 6,082 deaths out of their population of approximately 10 million. Whereas Norway and Finland, with a roughly equal combined population, and who did institute these intervention measures, has suffered only 650 deaths. That's pretty, that's a huge contrast. This is a classic slide of a sneeze expelling respiratory droplets. This is what we're all talking about. Sneezing and coughing are obvious for spreading droplets, but they're also released just through simply talking, breathing, singing, laughing. This slide of the relative size of particles helps to explain why, although the viruses are very tiny, many do fall out of the air within seconds or minutes within 6 feet. The brown snake-like object shown at the top on the right is the width of a human hair, averages around 116 microns. If you follow that line of images, 7 images down, you'll see a respiratory droplet at 5 to 10 microns. And 4 more images down, you'll see a coronavirus at 0.1 to 0.5 microns. Although viruses are substantially smaller than the respiratory droplets, they're usually contained in these larger, heavier droplets, which fall out of the air much more readily. So here you see red droplets being exhaled from the person on the left. They're much heavier, they're contained in those larger droplets, and they are falling out within a couple of meters. It is the smaller blue and yellow particles or droplets that actually can make their way further. They often will get dried out in the airstream. Think about we're going into heated buildings with drier air. There they become much lighter, they're suspended for longer periods of time and travel further on the air currents. Although they also become more dilute when they're mixing with the air they encounter, unless of course that air is already burdened with significant amounts of small droplets. So this is why ventilation becomes so critical in the discussion of indoor air environments. Droplet spread is still considered to be the primary method of COVID transmission infection. There have been some documented cases of airborne transmission. It seems that the extended periods greater than 30 minutes in enclosed spaces are the most problematic for spread. There's still much more that is unknown about the spread of this. The governor's guidelines do allow for some barriers to increase indoor seating in restaurants. However, we've not been able to find any information that this is as safe an option. Viruses can't reproduce if they can't infect a cell. So this slide is a simplification of a virus infecting a cell. All the methods we've been using up until now, the masks, the distancing, avoiding crowds, et cetera, are to keep from getting to this point. These circles with spikes represent a COVID virus. The blue here is a cell lining of a mucous membrane. That can be the back of the nose, it could be the lung or the conjunctiva of the eye. COVID-19 enters the body through the mucous membranes. Once a virus particle reaches a cell surface, which is in blue here, it attaches to the cell by those spikes and it enters the cell. Once inside the cell, it uses the cell's internal components to make more virus. Without entering a living cell, it cannot reproduce. So it does not reproduce on surfaces. It does not reproduce out in the environment. It has to be within living cells to reproduce more virus. Avoiding the opportunity for the virus to enter the body in the first place, or at least so little of it that it can't cause sickness, is what we've all been attempting to do for the last 7 months. Stay at least 6 feet away from others, cover your mouth and nose with a mask, avoid crowded spaces, wash your hands, etc., etc. We should act as if everyone we encounter right now is infectious. Antibody treatments, antiviral medications, and vaccines are all aimed at stopping these virus cell interactions that we're looking at right now, either blocking the binding of the virus to the cell surface in the first place, or once the virus is inside the cell, stopping the replication of making more viruses and all the other processes that go on for it to get re-enveloped and back out of the cell surface. This is where the arena that a lot of research is going on, and this is what we're going to be talking about a little more today. This high-powered magnification of infected bronchial cells shows significant production of the COVID virus after 96 hours after infection. The blue strands you see here are the cilia, or the hair-like structures on the surface of airway cells that transport mucus and dust and viruses from the lungs. The yellow stuff is just mucus, you can ignore that, but the red particles are the COVID virus that's been produced by these infected cells inside the respiratory tract. This large amount of viral production may be the reason this virus is so contagious. Infected people may be dispersing such a large amount of virus into the environment around them through normal activities of just speaking, breathing, and everything else, even if they're asymptomatic. This may also be why it's so dangerous for some seemingly healthy individuals who may receive overwhelming doses of virus, such as healthcare workers. This virus also spreads to other organs, and as more is produced, the more likely that is to occur. So this was really a great discovery of understanding the viral load that people are producing, and much more research is needed to understand what that all means. But although we're not out of the woods yet, there are reasons for optimism. We have vaccines, antibody treatments, and antivirals that have advanced. There are several potential vaccines under development, and some are in trials. The two that seem to be the furthest along it's a very long and complex process of vaccine development, but are from Pfizer and Moderna. Pfizer's and their partner BioNTech, which is a German company, are currently in phase 3 trials, and phase 3 is the final trial before a vaccine is approved for widespread use. Safety will continue to be evaluated in phase 3, but the effectiveness is primarily what they're looking at. How effective is this vaccine? The people that have received the vaccine have significantly, statistically lower rates of actual infection than those that have not received the vaccine. It takes thousands of study participants to really determine efficacy, but Pfizer reports in preliminary trials that they have a 90% efficacy rate. That is a very good rate. That's after 2 inoculations though. AstraZeneca and Johnson & Johnson are also in the later stages of vaccine testing. Remdesivir continues to have some application for COVID-19, but there are limits. And other antivirals are also being studied. And Eli Lilly and Company received an emergency use authorization on Monday for its infusion antibody treatment. These are all developments that we didn't have 7 months ago when we started talking about this. In a state of an emergency, the FDA can grant this emergency use authorization for vaccine or other pharmaceuticals to be used before it's undergone the complete standard process of approval. Under the FDA's emergency use authorization, the US is expected to receive $20 million per month. 20 million doses per month for a total of 100 million. This is currently contracted, but 100 million doses will only vaccinate 50 million people because the vaccine requires those 2 shots 3 weeks apart to achieve this good immunity. With a population in the US of 330 million, it's a drop in the bucket. Plus there's also global demand for vaccines. So the distribution plans are targeting priority populations. The US does have an option to acquire 500 million more doses. As mentioned, these vaccines will be distributed to priority populations first. The first tier of vaccine rollout is expected to target very vulnerable residents in our nursing homes and assisted living facilities, then healthcare workers and first responders, with a goal to be completed with this by February. There are some known side effects such as achiness and fever, and ultra cold storage is required for this vaccine. It requires a cold storage of -94 degrees Fahrenheit. And so that's presenting some handling and distribution challenges. It is expected that these vaccine developments will be achieving these important next milestones this month, actually November, 3rd week of November to the end of the month. However, in order to access a vaccine, there needs to be widespread review by many entities. So the vaccine is going to be critically evaluated. What we know today will likely change as the scrutiny and review process moves forward. But we're on the cusp of some reasons to be optimistic about this. So what I can say is remain vigilant. For right now, act as if everyone you come into contact with is infected. Avoid coming into contact with people unless it's absolutely necessary, and then limit the time and keep at least 6 feet apart. Do the things we've been talking about. Wear a mask. Outdoors is better than indoors. Send your love for Thanksgiving, not the virus. This is not forever. We're entering likely the worst of it, and we can be optimistic for some relief. We don't actually have to wait for everybody to get vaccinated for things to ease up. If our infection rate can get back down below 1%, and we have these pharmaceuticals at our disposal, that's very good progress in getting us back toward normal. That's all I have.
Wow. So back to
I cannot stop sharing. There you go.
there we are. And we need to stop the speaker view. So we'll go to gallery view. There we go. All right. Great explanation, Kim, of what we're looking at, and in a way that I think most of us can understand. It's in layman's terms, if you will, so that we can understand the science behind what it is that we're doing. So I'm going to ask Jen if she sees any questions in the chat room yet.
I don't see any questions yet.
Okay.
But I actually had a question. What if we have a member and they want to start testing their vaccine? And if you take that test or do that testing, are you in any danger, or could you actually be getting a vaccine, and be, immune? Is it a good idea to be one of these testees or tester people?
Would you like to answer that?
Oh, I'm sorry. Whoever would take the most joy from answering that?
Dr. Montero?
So I think most of the volunteers have been already selected by the companies and universities to get the vaccine test. I think now they're phase 3. I think the most of the enrollment has been closed. Kim, correct me if I'm wrong. And they're going to come up with results. Then they're going to start offering. And as I believe, it's obviously going to be voluntary, right? Once it's approved by the FDA, anybody that it's under those tiers, the CDC is going to release tiers of who goes first, who goes second in phases. And then if you are under that tier, if you need to, if you want to, you can go and get the vaccine. I'm not sure if I understand your question being.
Well, we do e-blast for our members, and I don't want to out anyone because the e-blast is not out yet, but we do have somebody who's looking for volunteers to test a vaccine. So I was just curious what your opinion was. And I know that they have to test thousands of people, and people are having a hard time finding volunteers, but it is out on their social media, et cetera. So.
Okay. So, when you have volunteers, and again, I don't know the details of that one specifically, you have usually an arm that gets just a placebo and another one that gets the vaccine, right?
Okay.
So you may be joining and not be getting the actual vaccine. So you're not going to know.
Right.
And 2, there are always risks and side effects of any study, not just the vaccine of drugs, but you may experience or you may not, right? So it's a risk that it's usually explained by the group and what are the chances, and it's of a great help. We need volunteers, we need people to be in those studies so we know what's going to happen, right?
Right.
So,
Okay, thank you.
Thank you. We have a question from Councillor Tabor. What age groups are seeing the most community transmission? Thanks for being here, Councillor Tabor.
I haven't looked today. I'm so sorry, Councillor Tabor. It's just been a straight out day, so I don't know what today's statistics are. It was hovering around 25 to 20, I think around 25%, give or take a few percentage points.
And I have some questions that have come in, Valerie. Do you want me to read them?
Okay, but I want to make sure that,
Oh, okay.
that Kim heard the question. What age groups are seeing the most community transmission? And you may have just answered that.
Oh, you're right. I misunderstood that. I don't have that right in front of me. That demographic is changing. When this first arrived in New Hampshire, it was definitely older groups because we had so many assisted living facilities that had been infected across the state. And so that's where we were seeing the highest transmissions. As it's been spread more to the community, the demographic is changing. It started getting younger and younger and younger. And now routinely on the reports that we get, the daily press briefing from the state, you see even people under 18 are getting higher levels of community transmission, or it's being reported that way. That can be flexible because if you think it's community transmission and then you realize down the road, oh, wait a minute, they had a direct contact with this person who's now COVID, that can change to a close contact with a COVID positive person. So they're a little bit in flux.
I do believe, yes, Kim is right. I think the 25 to 44-year-old is now the highest number of infections. So young adults, it's where we are experiencing the most infections at the moment.
So we know from experience locally, even in Portsmouth, that that it's some of our staff that are not necessarily following the best behavior. And in a conversation with my son who lives in a ski community in Colorado, they're thinking about not opening, and it's not because of the visitors, it's because of the staff. And so for the business community, that's a serious thing for us to be considering, is that how are we going to convince our staff that remaining responsible and kind and wearing masks and not gathering in groups is so critical. And I think each of our businesses need to think about that and how we're going to reinforce that communication. Because we are seeing, that's the age group that we're seeing is transmitting. So Jen, you have some other
Yeah, right. I've got two questions. Feel free to write more, everybody. This question is for Kim. It is from Lauren. Kim, with the higher rate up to close to 4%, what are your thoughts on why schools are not all remote? Should businesses think of shortening hours or closing?
Yeah, that's a really good question. And actually, what the state was putting out was, with their statistics, was that for a long time, the schools did not seem to be where the transmission was occurring. So it seemed like it was working for a while. High schools are much more difficult to control the spread in because you have children or students from different households mixing. And we've known all along that when you mix households, when you mix different geographic areas, things rapidly, our numbers go up rapidly. So I do believe the Portsmouth High School maybe have reduced to somewhat of remote because they had message from the state regarding one of their critical factors that you look at whether you decide to keep a school open or not. There's a grid in schools that you look at to say, should we be doing remote? Should we be doing hybrid? Are we safe enough to go back full time? And when you have some community spread in the school population, that's not the only factor. It's what's happening in the greater community. So we're at substantial spread in the Portsmouth community, and that on the grid is unaffected by the school. But when you're at that point and you look at what's going on in the school, the guidelines lead you to reducing down to remote. So at least to some degree, and that has occurred.
Okay, and from Councillor Lazenby, we have, it doesn't say who it's to, so you both have to pay attention. Let's see, can you talk about contact tracing? I read reports saying the state was going to reduce their amount of contact tracing because of the increase in quantity of cases. How does this impact Portsmouth? Does the city and or school system undertake its own contact tracing? And then he cites an NHPR article.
Well, I'm happy to start that answer, Dr. Lazenby. The contact tracing at the state is a little too delayed to be as helpful as we had hoped. So in order for the PCR tests, which are the ones that are most heavily relied on to pick up enough virus that your cells have produced to become positive, it takes like about day 5 is when you want to do that test. So if you've been exposed, you have 5 days of building virus up inside of you. And then the PCR tests will be best at picking it up 5 to 7 days. So then you get the test taken, there's 2 or 3 or more days of turnaround time when that test goes to a lab, the laboratory processes it and they report out the results. Then that report goes to the state of New Hampshire and that is done overnight generally, but we're already at day 8 or 9 at that point. And we have had reports increasingly of contact tracers not even being able to contact people until 5 days out, 7 days out. So by the time some people are getting contacted, they're already past the infectious period. They're already past that incubation period. So it's not working the way that we had hoped. And I think we're just at too high community levels now to expect the volume of contact tracing that has to go on. As I had said in the presentation, it's not just the people who are ill, it's the people that also have had close contact that have to be quarantined. So you could have one person working in a busy environment and you have 14 employees out because they were within 6 feet for more than a cumulative of 10 minutes. Doesn't matter if you have a mask on or not, according to the state definition. And they have to be quarantined. As far as the school nurses, they are doing their own type of contact tracing, but it's really limited to what affects the schools. So they're involved in that. They've asked for help with that because even that is getting incredibly difficult given their workload. There are 2 cities that do their own contact tracing. It's Manchester and Nashua. But Manchester has a full clinical staff of their contingent of public health nurses plus 22 school nurses, or 20 more maybe, because they have 22 schools. So they have 30 some odd nurses. You don't necessarily have to be clinically trained to do contact tracing, but they do have the workforce that's familiar with that. So if you'd like Councilor Lazenby to give us 62 more employees in the health department, we're happy to look into this for you.
Yeah, okay.
I just want to say, from a physician standpoint, not from a public health standpoint, I think contact tracing is very important, because that's how you really can sort of look back and see where that person that is infected had contact with, and then sort of communicate among that community to really have them quarantine, be observed, and avoid further spreading. It's a huge endeavor. Like Kim just said, it's very difficult. It takes much larger discussion, but at least just from a clinical standpoint, for a primary care, for any physician, I think that's essential.
Thank you. I have a couple of questions here. Speaking of contact tracing or testing out, we have been operating under the assumption that you can't test out of quarantining if you've traveled. And I think the governor said something differently yesterday about after 7 days, if you test out, you're out of quarantine. Can you speak to that, either Kim or Bianca?
Well, we've heard that guideline. It doesn't mesh with what we know scientifically, and we've not gotten any scientifically based reason for that change. So the city policy currently is that it's not changing its travel guidelines
Thank
for
you.
city employees.
Okay, thank you. Bianca, did you want to add to that one at all?
Yeah, so we're seeing a few states changing this a little bit to 7 days after you get tested. And I'm still not quite sure if this is just based on scientific data and published data, more of a local CDC guidelines. And that's how I kind of see it. I think Vermont is doing that too, either 14 days or 7 days with a test. Some other states are doing, but I don't think there's enough studies showing that yet.
So safe is 14 days quarantine.
Well, I would guess that maybe the thinking behind that, and this is a complete guess, but because the PCR tests you generally get tested at 5 days out, maybe they're including that 5 days plus 7 days is 12 days. And they're thinking that's closer to the 14-day quarantine period or incubation period, but that is just a guess.
Thank you. And two more questions. One is about the cost of the vaccine, and have we heard anything about how that's going to be covered, if that's going to be covered by insurance, if that's going to come through CARES Act or similar funding, or have you heard anything there? And a correlation is, because it has to be at 94 degrees below zero, who's going to be distributing this? I have heard that, you know, the Rite Aids and the Walgreens and so on are not necessarily equipped to do that. So if we can talk about both of those, please.
Well, those are the discussions that we're involved in right now. I don't know that there's going to be a charge for the initial waves of vaccines coming out, because they're going to our vulnerable populations, our emergency services, and our healthcare workers. I truly have no information on what a payment mechanism for that might be. We've talked a lot about the difficulty with the storage and distribution. The other thing about the virus is, the other thing about the vaccine from Pfizer is you have to use it within 5 days of thawing it, or you can't. So that's another restriction on it. So those plans are being looked at very carefully by public health networks across the nation. But certainly in New Hampshire, we've been talking about that, talking about receiving some freezers from the state in certain locations to be storage facilities. Those freezers are on back order, and they may be changing to look for entities that do have them standardly and can help. You know, so if you have a laboratory that has a freezer that is that cold, maybe the state can work with that laboratory to help out with this. Different things are being discussed.
Can normal freezers go down to 96 below 94 below zero?
I don't think so.
So even like restaurant freezers? No.
Right, and usually when you have something that's liquid gold, really, you have things like electronic monitoring systems so that if there's a jump in temperature, you know, somebody's right on it immediately. Commercial refrigeration for restaurants is designed differently than commercial refrigeration for pharmaceuticals.
Sure, that makes sense. Bianca, did you want to add to that?
What I know so far is that Pfizer made a commitment with the federal government to provide the vaccines for free. I don't have any more information on that. In terms of freezers, that's clearly going to be a problem. I can tell from a local level here at York Hospital, they are working to try to obtain the vaccines for employees. So I don't know if once it gets to a state level, the state's going to have to work with every healthcare system and have the healthcare systems help them too, because they might be able to get the refrigerators. So that I don't know, but it's going to require a great deal of collaboration among different entities to be able to distribute this.
Is there, so at some point, although we don't know now, if there's something that our business community can do to help, I'm hoping that you'll reach out to us so that we can share that information so that we can get our local community on board with it. So that would be that'd be great. Thank you. Jen, do we have any other questions coming in?
We have no additional questions at this time.
Okay, so I think we're about to the end of our time today, and so I want to thank every one of you for being here with us, and certainly to Health Officer McNamara and Dr. Monteiro. I am thankful that you were able to stay with us the whole time, Doctor, because there were no emergencies in the ICU. That's a good thing. So thank you so much for being here. I appreciate every one of you being here on this call today. I want to repeat something that Kim said, which is send your love for Thanksgiving, not the virus. So we often talk at the end of this program about it takes 11 hugs a day to thrive. And those don't have to be, and at the moment can't be personal hugs, but they can be smiles or something positive that you share with somebody that just makes their day. And we need 11 of those. So send your love and hugs through for Thanksgiving, not the virus. I thought that was a great thing to say, Kim. So we always try to send you away with a little bit of funny or inspiration. And so this one is that we're queuing up is, we're wondering what we're all going to do to stay healthy and get outside this winter. And Jen's found us something about, let's take up a new sport. Let's do some fun and thrilling and easy to learn, supposedly. That has not at all been the least bit affected by COVID. And so the following uplifting video by the New Hampshire State Parks will inspire you to get out of that chair, get off that couch, get your exercise. Either that or you're going to think that some of these talented winter sports enthusiasts are just a bit crazy. So let's see if we can lift your mood this afternoon, and I will see if I can share my screen. Give me a second here, and let's see if I can do this. Bear with me. So hopefully that was an inspiration to all of us. We either now want to get out there and learn how to surf or tuck in with a nice cup of tea and a blanket. So we do need to prepare to get outside this winter to stay healthy. So please do. And stay safe, stay well. Have a fabulous holiday. Normally we would have our next Chamber Chat live on the 27th, which would be the fourth Friday, but it's the day after Thanksgiving. And so we will not. We'll see you in December. I think December 13th. Anyhow, the second Friday in December will be our next Chamber Chat live. So thank you so much for joining us today. Stay well, stay safe, get that vaccine when it comes out. Bye.